Welcome to this latest webinar in Caring.com's Digital Marketing Academy. Our session today is about how to respond to online reviews from your customers and ideally take complaints and turn them into compliments. I'm Denise Graab, a marketing director here at Caring.com, and I'm thrilled you could join us for this educational session today. Before we dive into the presentation, I wanted to let you know this is a one-way webcast where only the presenter speaks. You are welcome to ask questions at any time, and we'll do a Q&A at the end. Number one question we typically get is is the session being recorded? The answer is yes, and I will have the slides and recording for all of you tomorrow. We love that question, by the way. This session is free of charge and sponsored by Caring.com. For those of you who are getting to know us, and as a refresher for our partners, Caring.com is a leading referral service for senior living and senior care and the #1 site for reviews of senior services, including assisted living, in-home care, memory care, care homes, and more. In fact, we were one of the very first to offer senior living and senior care reviews online, with some reviews on our website dating back to 2008. We're hosting more than 350,000 consumer reviews on Caring and 2 other websites we own, and we collect thousands every month. Each year, we compile the Caring Stars list of the best senior living and in-home care nationwide, and that is based on consumer ratings and reviews on Caring.com. This Service Excellence Award was the first of its kind in our industry, and overall, you should know this about our reviews program. It's very high integrity. We have senior care experts, not algorithms, that are reading the reviews before they get posted on our site. We have very well-established guidelines that determine which reviews get published and which reviews get taken down. And we have customer service staff available by phone or email if help is ever needed with a reviews issue. Now, for those of you not yet familiar with me, I've been at Caring for almost 12 years and have extensive experience with online reviews and social media. I was part of the original expert panel who created our review guidelines. I've been a key player in the program in the years since then, including as the co-creator and manager of that Caring Stars program I just mentioned. In my current role, I support consumers adding their reviews on our websites, and I also work with senior living and senior care businesses nationwide to help them manage and optimize their online reputation. A lesser known fact about me is that before I joined Caring, I was curating thousands of reviews on an education website. And in my personal life, I'm a very avid reviewer as well. So I have a lot of experience in this space, and I'm excited to share some of that with you today. As usual, I'm going to cover a lot of information that I hope will be helpful to you. We'll start by why it's so imperative that you respond to reviews, and we'll talk about how you do that on Caring.com and other review sites too. We'll also cover some do's and don'ts of reviews response. I have specific examples and scenarios, what to say and what to avoid saying, and there will be specific examples from our industry. We'll do the Q&A as I mentioned, and we've already gotten one question, which is that popular one I mentioned we get quite frequently. Will this be recorded? The answer is yes. We are recording this session. We'll be circulating the slides and recording to all participants afterward. And it's also archived on partners.caring. Thank you for that question. I also want to invite you throughout the webinar to add comments in our chat feature if you have a tip you'd like to share as I'm covering any of the topics. I know we have some marketing agencies on the line, so feel free to add in your tips too. And if I don't read them as we move through, I'll share during the Q&A. Okay, without further ado, let's get started discussing why it's important nowadays to respond to online reviews. Your potential customers are perusing your online reputation before they're expressing interest, before they're taking tours, before they're returning your calls. after they've seen enough reviews to persuade them to do this. You may have heard us refer to this as the modern drive-by. We've done some industry presentations on this entire topic. Search engines and online directories are showing ratings as commonplace in search results. The reviews are helping businesses rank higher and stand out. And US consumers say the top 3 areas where the online reviews are most important to them are service businesses, care businesses, and healthcare, all 3 of which are directly relevant to our industry. And it's not just the reviews that those folks are looking at. They're very interested to see if and how your business is responding to this feedback. It can help them feel more positively about doing business with you. Here's some specific stats to illustrate that from the 2022 study that search engine marketing firm Bright Local did. 89% of US consumers now say they are likely to use a business if it responds to both positive and negative reviews. Now, I know some of you can't respond to all. You just don't have the means. You don't have the time. You don't have the staff. You don't have a marketing agency yet. I get it. If you can at least respond to the negative ones, more than half of consumers can be influenced by you doing that. And if you're failing to respond to any reviews, you may be losing business because 57% of consumers are unlikely to use a business. 57% unlikely to use a business, opting out of responding to reviews. It's very important that you respond to at least the negative. Try to do both negative and positive. And they're also, Harvard Business Review, I've shared this study in some of my prior webinars. They looked at if a business responds, can it increase their volume of reviews? Can it increase their ratings? The answer is yes. 12% more reviews for the businesses that respond. 33% of businesses that started responding increased their average rating by half a star more within 6 months. So what didn't take years, it was within 6 months. We had a partner put this data to the test. They looked at their response rate and their review volume in 2019 and 2020. And they saw similar increases that Harvard found. So this data we've shared, it was for another industry, but it's been proven for ours as well. Now, every year, I mentioned at the beginning, we recognize senior living communities and home care agencies based on a high volume of great reviews and because they respond to every 1-star and every 2-star review they receive on their caring.com listing. This is a long-standing, very important criteria to be qualified for Caring Stars. You must respond to the 1-star and 2-star reviews by the deadline. And by respond, you either have to effectively contest and get it removed by deadline, or you have to have a public-facing response on that review on the caring.com listing by deadline. And the deadline is October 15th, 2022 for the 2023 award. We're going to be having an entire webinar on Caring Stars in August. I hope you can make it. But I want to give you just a few key points in case you can't. Any senior living community or home care agency that's listed on caring.com can qualify for this award if you meet the rigorous criteria that's based on those reviews. You don't have to be partnered with Caring to be a Caring Star, but we do know for those who are, we've seen significant boosts in inquiries and move-ins for them when they win the award versus our partners that don't have. And we covered that in our June webinar. I can provide those stats via reviews at Caring. There's no fees associated with Caring Stars, unlike some other award programs in our industry that are charging for both the resident and client surveys and have fees for licensing the award badge. With Caring Stars, the winner promo kits and the badge are free, no licensing charges. So contact Reviews at Caring or come to our August webinar to learn more about this award and make sure every 1-star, 2-star review on your listing has a response or is contested by deadline. Okay, so for today's webinar, I did a poll in the registration and I asked, what's your biggest challenge or hurdle in responding to online reviews? It was a write-in response and I compiled the close to 200 responses into these 4 categories. 40% of you are not actively monitoring your online reputation. You aren't sure where to begin. You lack the time, the staffing, or the expertise currently to do the review response. More than a third are concerned about what exactly they should say in the response, particularly with negative reviews. And 14% said they needed to get reviews to be able to respond. I hear you, that is true. And I'll be reaching out to you folks with that June webinar I mentioned to give you those tips to help you get those online reviews built up on your listings. I was actually glad to see that the number of people having difficulty getting invalid removed was less than 10%. It used to be more common that businesses in our industry thought every negative review was from a competitor or a disgruntled employee or it must be fake. There's been a lot of education since those early years, and businesses now realize that sites like Caring have many measures to prevent disgruntled employee and conflict of interest reviews. The majority of published reviews on our site are from seniors and their families who we help through our referral services. In our home care directory, there's a large volume of reviews from consumers that Home Care Pulse has talked to on behalf of the agencies. We have a partnership with Home Care Pulse. So thank you for everyone who took this poll, shared about your hurdle. I have information aimed at helping all of you. Let's get started talking about how to respond to reviews on the highest ranking and most popular review sites for our industry. Ignoring reviews isn't really an option anymore. You can't and you shouldn't hide from your online reputation or ignore it. You need to know what people are saying about your business online and take strategic action to manage that reputation, or else you're letting others define your reputation for you and missing some excellent sales and marketing opportunities. You need to stay informed of new reviews by closely monitoring. There are three main ways to do this. Some review sites will offer businesses automated and instant alerts by email whenever a new review has been posted about their services. Each site is different, and in the requirements you need to sign up for those alerts. So determine where you want to focus your efforts, where you're getting the most reviews, which sites are ranking the highest and are easiest for your potential customers to find and read those reviews, and then reach out and learn more about your options with that particular site, and see if you can get those alerts. There's also reputation management companies that have software platforms to help you monitor your reputation across multiple websites. They've gone out and established integrations with the various review sites. They've compiled all that review data in one place for you to log in and manage responding to those reviews. They typically also have other services like reporting and reputation analysis. This is a particularly good option for the larger businesses that have lots of locations. If you can't get alerts, some sites don't offer them, but if you can't get alerts and you don't have a subscription for the monitoring and responding platform, you can get a spreadsheet. You can put together a spreadsheet of the links to your profiles on the key sites that are most important, then visit them daily and weekly to see new reviews. So you're capturing those links to those profiles, going and visiting manually to see what's new on a daily or a weekly basis. The responding options are going to vary on depending on which site. They have different responding options, and we'll talk about more of those details pretty soon in this presentation. But I want to caveat that this last option of, keeping a list of links and having to click them and having to go view and read, this is the most time intensive, slowest, and least effective to manage your online reputation. But it is a workaround if you can take advantage of the other two. This is how you can respond to reviews on Caring. I get this question pretty frequently, and it's not required. This is a confusion point. It's not required to be a partner with Caring to respond to reviews, but we do have some conveniences for those who are a partner, such as the automated alerts. Any enhanced listing in our directory has access to this free service. And inside that alert is the text of the review, a link to your listing so you can see the review on our website, and action links. You can either contest the review if it has fact errors or you think it violates our guidelines, or you can publish a public-facing response to the review. Both of those options are conveniently linked right inside the email. You don't have to log into a dashboard. You don't have to remember your password. You just click the link, enter your information. We have code on the back of the form that helps us identify you and helps identify everything that we need to process that response. It goes into our highest priority queues for our partners, typically addressed within hours, no later than 1 to 2 business days. For any older reviews, let's say you just became a partner, or you can't find that review alert. You got it, but you can't remember where you put it. Please feel free to email our team at any time, reviews@caring. Include in your message which action you'd like to take. Are you publishing a response? Are you contesting the review? Give us specific details, like if there's fact-based errors or which guideline you think it violates. Make it as efficient for you and us as possible so you can get back to the rest of your day. Keep in mind what I mentioned earlier. We read every review before it's published. The majority of reviews on our site are for consumers we've helped. These are real reviews. We don't really have an issue with fake reviews like some of the other sites do. But if you think we missed something, do not hesitate to reach out. We're happy to look at it again. We're also integrated with 6 review monitoring and response platforms. So that's another way to respond on our site. And we do have some guidelines for consumers and posting reviews on Caring. Those guidelines also apply to review responses. We screen the responses just like we do the reviews. We don't publish responses that have defamation against the reviewer. We try to avoid publishing responses that are violating privacy. And then we have a few additional requirements to help ensure we have details on who specifically is responding for that business. I'm sorry, I skipped ahead a little too quickly there. Responses that are erroneously posted or need to be changed. Let's say you have multiple staff members getting those review alerts. Somebody posts a response that senior leadership doesn't like, you want to change it, no problem. Contact reviews@caring. We can help you get that updated without issue. That doesn't happen that often, but sometimes people reflect on what they said, want to change it. It's okay. It's not permanent, etched in stone. You can get it changed. All right, now let's talk about the valid reasons we will remove a review versus invalid. I've created a partial list here. Keeping this information in mind before you contest the review can save you time and be more effective in your review follow-up. And also, much of these also apply to other review sites as well. Consumers can retract their content from our website with or without a replacement review. This isn't as common as the other review removals, but it does happen. And not just when they're faced with litigation about the review. Sometimes the business has done such an excellent job in following up on the feedback and effectively changes their mind, which inspires them to change their review. I have a few stories later in this presentation of how I've seen this happen and how it can go terribly wrong as well. So we're going to cover that in just a minute. The other thing at Caring is we periodically audit reviews even after they're published. So we're not just screening them as they come in, we audit reviews. And we can remove any at any time that we think violate the review guidelines and anything we may have missed in our initial analysis. You can alert us of fact-based errors in the review to have it reevaluated and removed. We also occasionally remove reviews when there's business ownership changes, such as if the review specifically references the prior owner, or when a business stops offering a specific senior living or senior care services that the reviews are touting. You can contact us and let us know. Now, please contact reviews@caring.com to have any review at any time reevaluated and reconsidered, or use those new review alerts we talk about. But please do not ask us to remove a review because it's old, because you think it's unfair, because other people had better opinions of your business. Each review is evaluated on its own merits against the guidelines. We also very much appreciate your partnerships, but we do not remove reviews based on contract cancellation threats. And please do not send us any irrelevant notes or your subjective opinions about the reviewers and their families. It's unprofessional and in some cases can violate privacy healthcare law too. Going to give you some examples of that later. But first, I want to talk about one of the most common mistakes we see regularly in the contested review cases at Caring. And it's a misunderstanding of fact versus opinion-based comments. To be effective at contesting reviews and getting them removed, it's important to understand the difference between fact and opinion. I've compiled some common samples that come up in the reviews for our industry. For example, their billing is terrible is an opinion, and it's likely to upset you and your staff, especially if you've invested a lot of money and time into having what you think is a great billing system. But that's not a fact-based error, even if you disagree with it. By contrast, they sent us a bill for services we didn't agree to and didn't receive is a fact-based statement and can be contested if your agency or community has a signed a contract for the services you billed. That's just one example. There's many others here and others. I included some about staffing, dining, cleaning, responsiveness, when it's a fact, when it's opinion. To be most efficient and successful for the sites that will remove reviews based on fact error, not all will, Caring will. So look at the review content, focus on the facts, provide specific counterfacts. I don't like the way they describe our community in your message to the review site isn't going to be effective for getting that review removed. That's an emotional reaction to consumer opinion. We also get messages that simply say, this review is wrong, without providing any specifics about which sentences in the review are factually inaccurate and why. And often, unfortunately, in those cases, we find it's just a difference of opinion. They didn't like what the consumer said about their business, or they thought it was wrong of the consumer to share that feedback online. Those are all valid feelings, by the way, but they're not going to be effective for getting that review removed. Focus your energy and your efforts on the facts in the published content. Review sites are not going to remove reviews based on dislike of consumer opinion. This is not just Caring. This is nearly every legitimate review site is not going to remove reviews based on opinion. And the consumer may think poorly of your services. You may rightly think very highly of your services and staff. That's a difference of opinion. The public-facing guidelines is a good way to guide you actually in how to contest reviews. Keep in mind that review sites have to be fair. They have to be aligned with the Federal Trade Commission guidelines for how they operate, and they need from you what specifically in the content of the published review violates their guideline. On Caring, that can be as simple as which sentences in the review are factually inaccurate and why. Now, I know many of you have expressed that you're struggling with having time to build and manage your online reputation. There's just so many review sites out there. You don't know what to do. We know there's a caregiver shortage in our industry. We know your employees are stretched thin. It can be especially difficult if you don't have a software platform to help you manage too. So if you can only focus on two, I recommend you choose Caring and Google. Caring, because we're the longtime leader in hosting senior living and senior care reviews. We have very high integrity in how we manage the program. We stand out for that. We understand boomers and seniors need more than just online submission. We have phone-based review submission. Most of the other sites have online only. And we make sure that we have US-based staff available to help both businesses and consumers with this program by phone or email. We aren't just some giant monolith that's difficult to reach and get a response from. So that's why I would recommend you include us. I understand you got to include Google. So if you can only focus on two, Caring and Google. But the thing about Google is you need to understand their approaches and their policies with regard to reviews and review responses. They don't have experts like we do in our industry who are screening the reviews, but they do have a way for anyone on the internet to flag a review that is believed to violate their guidelines. You just click on the three dots in the upper right of the review and click report review. You don't have to be logged into their site to do that. It's available to anyone. Just select the reason from their menu and submit. There's not really a write-in form. You have to just click the dots, find the reason that's most relevant for why the review should be removed, and click submit. You may or may not get a response, but it's worth a try. And your business can and should verify your Google local profile. That's free, and it'll give you the ability to respond to reviews on their platform. They do not have a guideline against fact errors. So that fact versus opinion stuff I just covered with you isn't going to be as helpful for you on that site in getting a review removed, but you'll see some other guidelines there that are similar that can help you get a review removed. Now, if you're on Yelp as a logged in consumer, you can report a review. You have to be logged in. This is like Google, they're relying on the online community of users to self-regulate the reviews rather than having industry experts manage the platform. Business owners can also log into the app to report reviews, add comments, and even private message the reviewer. Be forewarned, though, on this platform, help has made it very easy for the consumer to keep changing their content and rating. So how you respond, whether privately or publicly, can immediately impact if that consumer goes up or down with the rating of your business. Now, we all know Facebook is the leading social network for boomers and even seniors nowadays, but it's a tricky platform. And the recommendations feature takes a higher level of online reputation management to manage, to expertise to manage. If you don't have excellent online community managers maintaining the integrity of your page every day, I would turn off their recommendations feature. I've seen consumers post disturbing images that violate seniors' medical privacy. I have found it very hard to get Facebook to pay attention to these matters. Even after flagging reviews, I found it difficult. And I've seen that consumers can just pile on the comments, create a mob environment against that business. So this is just some of the difficulty and sophistication it takes with that particular site. So pay close attention if you have it turned on. And like the other two, Facebook has a report post feature. But it's relying on the community and not industry experts to enforce their platform guidelines. On Caring, we're screening every review. We have the industry experts. We aren't just limiting this service to partners or just our referrals. And we have easy ways to reach us if there's ever an issue. Now, this is a tip I give in nearly every reviews webinar I do because it's very important. When you're corresponding with Caring or any reviews site, please avoid disclosing any private or confidential information about the reviewer or your customers. Keep in mind, written correspondence can be subpoenaed if there were litigation involving that review. And frankly, at Caring, I can't speak for the other platforms, but at Caring, we don't want you to send us private or confidential information. We don't want that. And please avoid disparaging or defaming the reviewers in your messages to review sites. This may seem silly or surprising that I have to suggest this in a business webinar, but unfortunately, in 2022 at Caring.com, we still get emails contesting reviews with comments about the reviewer being terrible at managing their finances, or claims that the reviewer is only giving a review because they're a drunk, or claims that family members say the reviewer is crazy, and similar things like that. This is not only unprofessional, it's ineffective. It's not going to get that review removed. And in some cases, it even helps build the case of the consumer's opinion on how the business is handling its customer service. And always, always, always avoid disclosing healthcare details in your review responses and in your emails to the review sites. I'm going to share a few more tips on how to stay compliant with the Health Insurance Portability and Accountability Act, or HIPAA, later on in this presentation. Be mindful of this concern before you hit that send button, but avoid disclosing confidential or legally protected healthcare information in your review responses and your review correspondence. Here's a course of action chart I give to remind senior living communities and home care agencies. When you get a new review, ask yourself some questions and consider your options to determine which is the best course of action. If the review has fact-based errors, you can contest that review on caring.com. Not so for Google and to a certain degree on Yelp and Facebook. If you can't contest for fact error, publish a response. That's true for review guidelines as well. If you think the review violates the review site's guidelines, notify that site, flag that review, why you believe that review is outside the guidelines. Just don't stew about it. Take action. And if you can't get it removed, publish a response. Now, in either case, separate from taking online action, consider your offline options. Is it possible that you have a manager or a leader in your company with the skills to effectively and professionally follow up with the reviewer? This obviously requires you know who the reviewer is, and some sites, including Caring, allow the consumer to remain anonymous. We have the reviewer identity information, which we'll release under court order or law enforcement requests if we have to. But we also know that consumers fear reprisal for sharing feedback online. So we enable them to do so within our guidelines without that fear of being anonymous. If you can't follow up offline because you don't know who it's from, you can take action online and you can move on to others who are happy with your services and focus on those who need further assistance with their account with you to avoid more negative online reviews. Now, there are some wrong ways to follow up offline to online reviews, and I'm going to tell you two real stories that did not end well for the businesses involved so that you can avoid these errors. I've adjusted some of the identifying details and I've removed names to ensure confidentiality. No one wants to be connected to these mistakes, and it's very possible they learned and won't repeat them either. First, let's talk about erroneously accusing someone of posting an online review. In early June, I received a call from a senior who was frantic. She was very upset. She had just gotten off the phone with a senior care service provider who had accused her of posting a 3-star anonymous review on caring.com. She took me through the details. She asked me to please get that review down and fast, even though she said she was fairly certain she hadn't posted that online review. She wondered if maybe somebody had used her name to post a bad review about the business. I found the review and I told her that her name and identity info wasn't associated with that review. I offered to follow up with the business to make sure they knew it wasn't her. She gave me permission to share her name and mention our discussion in my follow-up. I did what I promised, and I also reached back out to the senior to reassure her everything had been handled. I did not disclose to anyone at any time during this process the real identity of the actual reviewer in this case, and the 3-star review remained published without a response. Keep in mind, 3 stars is a middle of scale review. It's neutral. And in some cases, that's all a satisfied consumer is willing to give as a rating for that business. This is not a scathing 1-star anonymous review. And even if it was, never start dialing your customers and accusing them of acts they may not have committed. This can only end badly for you. In this case, the business now has one semi-satisfied customer, the one who posted the online review. And now they may also be getting a 1-star or 2-star review from the customer they wrongly accused of that anonymous review. And frankly, it doesn't matter who posted the anonymous review. You can respond well to any review without knowing who exactly had that feedback for your services. And we're going to talk about what to say and what not to say to anonymous reviews in just a moment. Here's another example. In this case, the consumer started off very happy with the business, even posted a 5-star review about them online. but he became dissatisfied over time and communicated his dissatisfaction to the office staff of the business. They even communicated that they were going to discontinue service, but the business took no action in handling that offline feedback. A couple months later, he went back online, changed his 5-star review on Yelp to 2-star. He waited a couple months to see if he'd cool off and feel differently, to give the business a chance to make things right. They didn't, and his feelings didn't change. His review was very specific on what went wrong, and the business was very upset to read that. Within a few hours, the business owner posted a snarky response questioning the validity of whether this reviewer was even a customer. In reality, this customer had used them for 5 years. The owner admonished the consumer for not going to the business first. The office staff also reached out and left a voicemail that repeated that complaint, go to us first. And like the owner, showed no remorse for losing the customer's business. And the office staffer even debated some of the details of the review. This reaction of the business, both their public response and their offline follow-up, caused the customer to lower from 2 stars to 1 star. Remember, I told you it's very easy for consumers to change their reviews on Yelp. They updated the review and what happened since they posted the first one, and they followed up with an email to the business reminding them that he had in fact come to them first with his complaints. He had waited a sufficient amount of time to post the negative feedback. Now, back to that Bright Local study I mentioned at the beginning, they found that 80% of consumers are likely to leave a positive review if an initial negative experience is turned around. So when you have a customer service failing or a customer cancels, have a protocol for capturing that feedback and following up to address the customer's concerns as best you can. Make it a point of habit and ingrained in your operations to gather and document feedback, how well your business could have better served the customer when they canceled. This could help you avoid making several of the mistakes this business made, which didn't result in them getting a better review or the review removed. Their actions instead led to a lower rating and increased dissatisfaction by a consumer who's unlikely to ever use them again and is likely to warn others. Now let's talk about what to say and what not to say, and then we're going to move into Q&A. Shout About Us is one of Caring's reviews integration partners. They focus on major marketing agencies and large multi-location companies. They're not working with individual small businesses. They're working with major marketing agencies and lots of location businesses. Their website features some clients in our industry, including G5 and Comfort Keepers. And one of their specialties is helping businesses craft personalized and custom responses. I'd ask if they'd share a few tips here, and here's what they shared. First, if you search the internet for the keywords review response templates, you're going to find millions of results. That's right, millions of samples of templated responses are out there, and most of them are free to use too. But today's consumer is turned off when they see a business post the same response across all of their reviews. And this can be even worse than not responding at all. Shout About Us, recommends that you instead personalize your response unless the screen name is anonymous. Dear Anonymous is just awkward and impersonal. Skip the personalization in that case. But if they've used their real name, Shout About Us suggests you use it too. Next, they recommend you include at least one specific detail from the review to demonstrate you're paying attention, you understood the content. You're not some response bot, you're a real human who cares about what the consumer cares about too. And since they work with national change, they recommend you keep the response local, highlighting the details of the specific location being reviewed. I'm showing here 2 samples following their guidance. One is for a positive review, one is for a negative review. In both cases, the reviewer is addressed by name, the local office is referenced, and there are details about what they loved and what bothered them. If you'd like to reach out to Shout About Us, visit their site or contact Reviews of Caring, and I'll help introduce you if you're a marketing agency or multi-location company. Consumer Fusion is also one of Caring's reviews integration partners. They've done a few webinars with us, including one on how to respond to reviews while being HIPAA compliant. We have the slides and recording for that sessions on partners.caring. You can contact Reviews of Caring. I'll send them to you. I've compiled a few tips here from the companion blog post they did, which they graciously agreed to share in this webinar too. They point to the fact that the policy set forth by HIPAA can be difficult to navigate and can discourage many healthcare providers from addressing their online reviews altogether. But as we've discussed, you can't ignore reviews anymore. And it's important instead to implement a HIPAA safe strategy by responding to both positive and negative reviews. Consumer Fusion's key tips are that you not confirm the person was a patient. Don't confirm you delivered healthcare services to them. Don't disclose any private personal healthcare details in your response. Don't argue with the reviewer. Don't apologize for healthcare services rendered, because that's confirming that that person was a patient. And they also strongly recommend you take the conversation offline, have a direct conversation with that person rather than continue online. This is particularly applicable for Facebook and Yelp, which have those conversation features you won't see on Caring. On Caring, there's one consumer review, one business response. We don't have private messaging. There's no crowd commenting or any of the other social features we've talked about for some of the other sites. I'm showing some samples here of responses to online reviews that are HIPAA compliant, one for positive, one for negative. If you'd like the full blog post and webinar, reach out. We're happy to share it with you. Now let's dive into some additional tips I would add. First, I want to address the myth that most online reviews are negative and it's just a complaint fest out there. It's not true. Most online reviews, not just on Caring, but other sites other sites as well, are positive. Most reviews are positive. In fact, 75 to 80% of online reviews are positive. But many businesses skip responding to the positive reviews and only focus on the negative, and it's a missed opportunity. These responses can be helpful to your marketing. So here's some best practices. Show gratitude for the feedback. Be conversational, but maintain your professionalism too. Avoid the emoticons, but do be authentic and conversational in your tone. Add relevant information about specific services or company values that were in the compliments that you received to further persuade the prospects reading the review and its response. Don't be shamelessly too self-promotional, though. That's where it can go wrong. Definitely promote excerpts of your positive reviews in your social media profiles and your marketing materials, anywhere the review can help you persuade other prospective customers. Here's some specific examples from reviews and responses posted publicly on caring.com. I know many of you have expressed having concern about not having enough time to respond to reviews, but look at the brevity, the professionalism, and the excellence of these responses. It doesn't have to eat a bunch of your day. You can thank the customer, show other prospective customers how grateful you are to have the feedback, and share a tidbit about your services that reinforces the compliments without sounding promotional and being conversational. Now let's talk about the more difficult ones, the negative reviews. You've probably already experienced this already, and we've talked about it. Customers' feedback in their reviews can be unfair. It can even be rude. Try to avoid having an emotional gut reaction. Stay professional, be gracious and grateful for the feedback. After all, consider this: the consumer is surfacing feedback that you might not have otherwise been aware of. It gives you the opportunity to manage your reputation by being more influential than the review itself. Like Consumer Fusion, I also recommend you avoid debating the reviewer. Definitely do not disclose any private information. Try to be empathetic. Try to remember that family caregivers and the seniors too can be really grumpy and stressed, particularly in these times. We're seeing increases in grumpiness and stress. So try to keep that in mind and be empathetic. And the negative feedback, it might be more a reflection of the situation they're in than your services. So try not to take it personally and avoid blaming them in the response. Another key strategy here is to get your happy customers to post their feedback too. As I mentioned, we covered that in June. Email reviews at Caring if you need those tips. Try to have a growth mindset. How this feedback from this one person can help your business be better at its mission, at delivering excellence in its service, and ensuring that more customers are strongly compelled to post 5-star reviews instead of the one like this one person's 1-star review. You don't have to agree with anything the reviewer says, but you do have an opportunity to make good choices for managing your online reputation. And you can make more of an impression on the readers of that review than the reviewer themselves. A few tips about review response on Caring. We don't timestamp your response. No one's going to see the delay between the review and your response. Take your time, craft a great response. We also, like I said, don't have a conversation feature. You don't have to worry about it going on and on and on. There's one review, one response. And we don't alert the consumer reviewer, and there's no private messaging. So you can feel confident managing your reputation on Caring with greater ease and well-crafted responses. Here's a few examples of what I'm talking about. I've masked some identity info here on these. These are real reviews and businesses on Caring. You'll see they did not approach this feedback with dismissal or defensiveness. They didn't claim these were competitors or disgruntled employees. They showed appreciation. They invited an offline conversation. Some even admit issues they're working to resolve, such as dirt or disarray from remodeling. And here's something you might consider doing after this webinar. Go to Caring's directory, do some searches in your area, visit your competitors' listings. Are they responding to reviews? How well are they responding? This could be an area of opportunity for you to stand out. Now I'd like to tell you a story, actually 2 more stories, and then we'll go to Q&A. First, let's start with missed opportunity. Some of you are serving multiple family members in one family, one resident, multiple family members. One could be displeased while others are happy. One could go online to share their feedback while others don't. Each consumer is entitled to his or her own opinions. Families are often not united in their perspectives. This is a case where that happened. The unhappy family member posted their review and the happy ones didn't. Unfortunately, the business didn't respond as well as they could have. They complained to the review site that the other family members are happy with their services, so the review site should take down this person's review. That didn't work. It wasn't a valid removal reason. So they posted a response documenting the positive feedback from the other family members. That sends a clear message to anyone reading that review and its response. Only certain people's feedback matters to them, and that's the people who give them compliments. It sends a message of dismissal of the reviewer's feedback as invalid, and other consumers may wonder if they too will be in those same shoes in the future if they do business with that provider. On the right side of the slide, you'll see an expert of the response that was posted. I've taken that response and recrafted it in the sample below. This was a non-medical, non-healthcare situation. No real identity info was exposed for the consumers involved. The revised response approach recognizes the reviewer's feedback, expresses gratitude for working with multiple members of the family, still gets in some of the other family members' feedback without disclosing exactly what they said privately and without dismissing the reviewer's feedback. It also invites this reviewer to contact their business to discuss it further. Even if that never happens, it communicates to others reading this exchange that the business is open to the feedback, open to discussing concerns, and focused on stellar customer service. Now let's talk about an exceptional case that started off awful and ended wonderfully. This is the story that directly illustrates how it's possible to turn complaints into compliments. In this scenario, the customer was very unhappy and communicated directly with a manager. She found that discussion unsatisfactory, and she overreacted by posting a 1-star review on 2 different review sites. On Caring, by the way, this is grounds for review removal. We publish original content reviews that aren't published elsewhere, but on these two other sites, they didn't have staff monitoring. Unfortunately, the review content accused the business of criminal acts, including fraud and record falsification. It was an atrocious review, the worst you could ever expect of your business and one you hope you never get. Thankfully, the business was registered with both review sites and got instant alerts in both places. Here's what they did. First, a small group of relevant executives came together and discussed the feedback. While the reviewer had tried to mask her identity, they recognized immediately who it was based on the first name, location tag, and content inside the review. They revisited their customer service files and they discussed the recent phone call the manager had had and what had happened. They looked at much of the internal information as possible. They discussed their options, including possible legal action if they couldn't resolve in any other way. That was a last resort. They did not post an angry online response. They decided they want to try to resolve this first before posting an online response. They also had their PR team reach out and try to get what the reviews removed based on libel and duplication. One review site agreed, one review site refused. A senior level leader at the business reached out. He has a focus on and specialty in customer service. He worked to get a meeting with that customer to discuss their concerns. Didn't mention the review in the outreach, focused on meeting to make their offline relationship with that customer better. During the meeting, they asked for more information about why the customer was displeased and let her vent. Didn't interrupt her, didn't get angry at her allegations, didn't try to aggressively shut her down. He listened and where applicable, he took responsibility for any downfalls or errors in their services. He demonstrated through his tone, words, and actions that his business truly valued customer feedback and was focused on great customer relationships. And toward the end of the conversation, once the customer had expressed all their concerns, the business had taken responsibility, there was some education on the services that can be offered and provided. The leader then mentioned the review, how it was shocking and very disappointing to see the criminal allegations against the business, and how he hoped through the conversation he had helped alleviate some of the concerns and proven the business was operating legally and with good intent. He suggested she consider how she would feel if such a review had been posted about a business she was managing. He didn't threaten her with lawsuit or dismiss her feedback. As a result, she apologized and retracted the review. And she not only retracted it, she posted a 4-star review. She can change it back at any time. So the business must remain vigilant and focused on that excellent customer service. This is just one example how a business can use a terrible 1-star review and turn it into a learning experience and growth opportunity, and even a compliment. I hope the other examples I've provided have also given you guidance on how to best manage your online reputation too. Now let's dive in to your questions and take a look at what we've got in terms of tips too. This is great. Okay. Let me go straight to the questions. First question we always get, is there a recording? The answer is yes, we'll have a recording and the slides. And we also have in the slides the tips on how to address the anonymous reviews, both negative and positive, lots of samples. There's a question about where do I see the reviews? We're talking about public-facing online reviews in this webinar on business profiles on various review sites, including on caring.com listings in the directory on caring.com. So if you're searching for assisted living, in-home care, there's business profiles, and on those business profiles are the reviews. Same thing for Google, same thing for Facebook and Yelp. Now we got a question about how to reply to a review if you're not a partner of Caring. We covered a few different ways about how to do that. Since you're not a partner, you cannot use the new review alerts. That's only for enhanced listings, but you can email reviews@Caring at any time for any review, old or new. And we are integrated with 6 different monitoring platforms. And I will have those listed in the slides that are circulated after this webinar. Thank you for that question. Now, this is a great question. And I get this occasionally, and I really love this question. If a company had not responded to reviews in the past, how do you feel about going back to these old reviews and now responding? It's going to vary depending on the site, but I can tell you that on caring.com, anyone in the public is not going to know there was a time difference between the response and the review. We're not going to put a timestamp on that response. So you can go back and respond to some of these old reviews. I don't recommend that you mention, oh, I'm just now seeing this review from 5 years ago. Not a good idea. But use the best practices we talked about and just reply as if you had just gotten that review yesterday. And like I said, no one's going to know except caring staff, of course, and we're not going to tell. That'll be our little secret. And for other sites where they do show, they show your timestamp and people see the delay. You can simply apologize for that delay and move forward with the best practice response. So thank you for that. People know none of us are perfect. So you missed a review, not the end of the world. Just apologize for it and respond. Does anyone have luck? Here's a good question. Does anyone have luck with Google removing reviews? I personally have had luck with this, but you have to make sure that it's a valid removal request. You have to make sure that their guidelines and what they've identified as items they're willing to remove a review is actually easy for Google staff to see that in the review. So that's where it gets tricky. So make sure you read those guidelines, you're very familiar with them, and you're not reacting to opinion. You're reacting to facts that are obvious and that clearly violate their guidelines. I'll give an example. Google has a guideline that's conflict of interest, doesn't allow employees of the business to post reviews. Many people miss that and they post employee reviews on their business profile. They go ask all their employees, post 5-star reviews about us on Google. Bad idea. Anyone on the internet can flag that review and flag it for conflict of interest. And if it says I'm an employee, it's very easy for Google to see that it violates their guidelines and Google will remove it. So that's one example. Like I said, you have to contest based on valid reasons and not based on opinion. I find you're going to have the biggest difficulty and not be successful if you're contesting just because you don't like the way they describe your business. You don't like what they said about your business, but it's all opinion based. Okay. So here's a good question about caring.com, and I'm really glad this person asked. They found a 1-star review. They hadn't got an alert about it. And is there a setting they should enable? Here's the first step in a case like that. Contact reviews at Caring. Our team has copies of every review alert we've sent. We can resend it to you. We can also tell you why a review alert wasn't sent. It's very rare that we have a technical glitch. Occasionally happens, but typically it's because that particular resource, like assisted living or in-home care category, wasn't in our partner network, so it wasn't enabled for alerts at the time of the review. So when you become a partner, we don't retroactively send you alerts on the old reviews. It's proactive from that day forward. So contact reviews at Caring. It's never too late to respond to an old review. All right. And then I got the question about that email address again. It's reviews@caring.com. I can help you with any information that I covered in this webinar and anything that I didn't cover. Okay, oh, this is a really great question. We got a question about there's multiple members of a family, and some members of the family have legal right to make decisions for that seniors and some don't. But if the ones that don't are allowed to visit the community, engage with the resident, that is considered firsthand experience. And even though they don't have the legal right to make care decisions for that senior, they are enabled to post online reviews. So they still have the right to give feedback about your services because they are able to enter the community, experience your services, and give feedback about it. Great question. I get that a lot. And this person also commented that these family dynamics can be real tricky. I hear it. And that the provider can get scapegoated for the challenges that the family's having, that these are really real issues. Agree 100%. And customers in the real world can be difficult to deal with. Social media and online reviews can be unfair, but we can still make great choices on how we respond to the review to influence our future prospective customers. And we can focus on getting great reviews that balance out that negative feedback. Okay, great. So I think I've made it through all the questions, but if I missed any, or you have something afterward, please don't hesitate to reach out for me. We're at the top of the hour, so I just want to summarize what we covered and also make sure you have our contact information. So we talked about your business's response to online reviews is now necessary, not optional, and can be highly influential. You need to monitor and manage your reputation on the highest ranking and most popular sites for our industry. Get to know the guidelines, get to know how to effectively remove reviews, how to respond, stay professional, really do your best to avoid overreacting. And then use best practices and honor HIPAA when you're publishing responses. Be empathetic, demonstrate excellence, be open to feedback. And keep remembering you're making an impression on the prospects. If you can't change the reviewer's mind, if their mind's made up, you still can make an impression on the prospects. And I've shared throughout the webinar the ways that Caring is managing a high integrity platform and has been a leader, fair guidelines across all reviews and all listings, support for both consumers and businesses. We want your feedback too. We're going to prompt you with the survey. This is our phone number, and we have that Reviews of Caring email. I hope you have found this webinar helpful. I really appreciate you taking time throughout your day from your day to attend this webinar. Please let me know if you have any questions or feedback, and take care.